Okay. Hi, my name is Whitney. What's your name?
Hi, I'm Audrey.
Okay, I'm a family nurse practitioner student.
Okay.
I'll be doing your exam today.
Okay.
Just washing my hands real quick. Audrey, what brings you in today?
I'm feeling kind of dizzy.
Okay. Can you tell me, is that dizziness like lightheaded, or is like the room spinning?
The room's spinning.
The room is spinning.
Mhm.
Okay. So we call that vertigo.
Okay.
It's hard to decipher lightheadedness versus, or I'm sorry, when people say dizzy, lightheadedness versus vertigo. So I am able to establish that's actually vertigo when the room is spinning.
Okay.
So let me just ask you a few more questions, then we'll get on with the exam. So can you tell me your birth date?
Yeah, April 3rd, 89.
Okay, so you are a 28-year-old Caucasian female. And Audrey, can you tell me where you are today?
I'm at Research Medical Center.
Okay, and what brings you here today?
I'm here for the vertigo.
For the vertigo, okay. So she is alert and oriented ×3. She can tell me her name, her birth date, and where she is and why she's here. So now we'll get on with the exam, Audrey. Can you tell me, when did that come on?
A couple days ago.
Okay, and was that a gradual or a sudden onset?
It just kind of started happening. I mean,
okay, but does it come on suddenly when it does happen?
Yeah, it does.
Okay, so a sudden onset over the last few days, it's been happening. And where could you tell the location? Like, is it full body or just your head?
It's mostly just my head.
Kind of spinning in the head, like the room is spinning, you said. Okay, and how about the duration? Does it come and go periodically, or is it consistent?
It comes and goes.
Okay, so it's very transient, periodic, not permanent for the last few days. Okay, and the character, you said kind of like the room is spinning. Are there any aggravating factors?
Not really. It just kind of comes and goes on its own.
Okay, how about alleviating?
Again, it just kind of comes and goes on its own. I can't.
With time, it just comes and goes. Okay.
Yeah, but nothing I can do to fix anything.
Okay. Haven't found any other aggravating or alleviating symptoms. Radiation might be tough in this situation. Does it radiate anywhere?
I don't know if it radiates anywhere. I mean, my ear hurts, but I had an ear infection, so I just.
You've had a recent ear infection. Okay. That we'll need to discuss further. So the timing, it comes on suddenly, there's really no rhyme or reason, and it goes away sometimes. And the severity, is the vertigo severe?
It's pretty bad, yeah.
Okay, when it does happen, but it goes away. So it is severe vertigo. And you mentioned the ear, are you just getting over an ear infection?
Yeah, a couple weeks ago, they put me on some antibiotics.
Okay, so you were treated for that, but still showing some symptoms and having some pain?
I mean, it only hurts like 2 out of 10, so it doesn't hurt that much. I thought I was just trying to like get over it.
Okay, have you noticed any hearing loss in that ear?
I don't know. I mean, I can't really tell. I haven't really been, no one's really checked it.
Okay, we'll check that today. And how would you rate the pain level in your right ear?
About a 2 out of 10.
2 out of 10, okay. And how about the severity of the vertigo?
It's pretty severe.
Pretty severe, like a 9, 10, when it does happen?
I mean, it makes it hard to like stand up straight and everything.
Okay,
so it's just sit down, lay down.
Not quite debilitating, but pretty severe.
Yeah.
Okay. So I'm gonna go ahead and ask you some other questions, a lot of yes, no's, like any symptoms that may be related to what I think might be going on. Have you had any nausea or vomiting recently?
No.
Okay. How about, you did mention the recent ear infection, it was treated, but we may have some ongoing symptoms. We'll take a look at that ear in a moment. Any tinnitus or ringing in your ears?
Not really.
No, okay. Visual changes or problems you've noticed?
No.
Okay. How about sensitivity to light or photophobia?
Not that I'm aware of that.
Okay. Hearing loss?
Like you
We'll
said,
check
like
that
I
out
said, I
further,
don't know.
but-
I haven't really done anything too crazy that would make me notice it at this point.
Okay, we might notice some more of that on exam. We'll check that in a minute. How about any headaches or migraines?
Nope.
Trouble talking or trouble with your speech? Okay. Stiff or sore neck?
Nope.
Headache, just so I know. Have you or anyone around you, but more importantly you, recently had the measles, mumps, chickenpox, flu, mono, or
No.
okay,
Everyone has been pretty healthy.
okay, or adenovirus? Nope, just the ear infection.
Mhm.
Okay. Some more yes or no questions. Have you had any recent fever, chills,
Nope.
weight gain, or weight loss?
Nope.
You said no to headaches. How about recent head injury or trauma?
Nope.
Trouble swallowing?
Nope.
No, you swallowed for me. How about shortness of breath, wheezing, or coughing?
Nope.
Okay. Chest pain or palpitations? Seizure activity, you noticed it? Anyone told you you've been having that? Confusion?
No.
Any numbness, tingling, weakness?
No.
Anxiety?
No.
Okay. Enough with the yes or no questions, right? So can you tell me what surgeries have you had in the past?
I've had a C-section.
Okay.
And
A couple of years ago?
Yeah.
Okay. So you're recovered from
Yeah,
that.
we're good with that.
Okay. Any tonsils as a kid or?
Yeah, I had a tonsillectomy.
Okay. Childhood?
Yeah.
Okay. So tonsils and C-section. How about family history, mom, dad, grandparents, siblings?
There's some obesity on my dad's side. And I think my mom might have some hypertension, but that's nothing too crazy.
Okay. Grandparents?
Like I said, I think you know what, my grandfather did have some skin cancer.
Skin cancer.
Mhm.
Okay. Any siblings?
No.
Okay. Family history of otosclerosis? That has to do with the ear. Anyone ever told you that?
No.
Okay. Family history of migraines or brain tumor?
No.
Good. Are you up to date on your immunizations?
Mhm.
Had a flu vaccine this fall.
I plan on it next week.
Plan on it. Good. Recent eye exam. I think you said that was a few months ago.
I did have one recently, yeah. I'm 20/20.
Oh, yeah, big vision. Okay,
Yeah.
so we will decline that Snellen
glasses
chart
yet.
later. And how about a well woman exam?
Yeah, a few
Pap
months
smear.
ago.
Okay. Mammogram or colonoscopy? You didn't mention family history and you're not of age.
No.
Okay, so don't need those. Social history. When was your last menstrual cycle?
A couple days ago.
Okay, and who do you live with?
My husband and my 2-year-old daughter.
Okay, great. And what do you do for work?
I'm a 6th grade teacher.
Okay, a teacher, nice. And do you feel safe at home with your husband
Absolutely.
and child?
Absolutely.
Great. And have you ever had feelings of hurting yourself or someone else?
No.
Great. Those are just questions we ask during all visits. So thank you for answering those. Medications, do you take multivitamins, herb supplements, or any prescriptions?
I take a multivitamin, and sometimes I take some ibuprofen.
Ibuprofen. Do you know the dosage of that or how often you take it?
I think it's those 3 pills. So I think it's like 600 milligrams. Is that right?
Mm-hmm.
And I haven't had any this week. But
Okay.
sometimes I take.
But you
that.
follow the label, never take
Right.
more or too often.
Right.
Okay. There can be some side effects taking too much or too frequently of ibuprofen.
Okay.
Are you allergic to any foods?
No food. No. I am allergic to penicillin.
Penicillin. What reaction does that give you?
I have a really bad rash.
Okay, rash. So we won't give you any of that today. And any environmental allergies, seasonal allergies?
No.
Okay, great. How about use of tobacco?
No.
Okay, alcohol use?
Yeah, I drink a beer or 2 here and there.
Okay, just socially?
Yeah.
Not more than like 3 in a sitting? Or-
No.
Okay. And ever used illicit drugs?
Nope.
Okay, and you said you're married.
Mhm.
Do you have any pets at home?
I have a cat.
Okay, he's been vaccinated and.
Yep.
Okay,
Goes to the vet every year.
great. Has anyone close to you or you recently traveled abroad?
Mm-mm.
Okay. Let's see, we'll move on with the exam. So Audrey looks dressed appropriately for the weather today. Her affect is pleasant and perky. So thanks for that, Audrey. And she is alert and oriented ×3. We previously asked her name, date of birth, and where she is, and what brought her in today. So she's having a clear thought process, alert and oriented. My nurse took her vitals, and her temperature was non-feverish at 98.6. Her blood pressure was very healthy at 120/60. Her oxygen saturation was 99% on room air, and she's about 5'9", and she weighed in at 165 today for my nurse. So now we'll move on, and I'm going to take a listen to your heart. Okay, so listen to the aortic, pulmonic, Erb's point, tricuspid, mitral. Go back through with my bell. And we'll listen 1 full minute. Thank you for lifting your breast to the apical point. The apical pulse for 1 full minute. Okay, I'm getting a heart rate of 70, which is normal. I heard an S1, S2, no murmurs, gallops, or rubs that I was hearing, which is good. And again, the pulse was 70. Now I'll listen to those lungs. If you could just breathe normally for me. Okay, under your arm here. And on the back side. Usually I would listen to all heart and lung sounds under her clothes, but for privacy we're listening on top. Getting under her bra strap there, that's often forgotten. Okay, so I'm hearing regular rate and rhythm. I did count respirations of 18 within 1 minute, and she mentioned no shortness of breath, trouble breathing, and I did not hear any adventitious sounds of crackles, rails, wheezes, so heart and lungs were healthy. She did mention that recent ear ache, or ear infection rather, so we're going to take a look in the ears. This is her left ear, has not given her any trouble. Usually we'd have a cap on this. Any trouble when I touch the tragus or the auricle? Pain or tenderness on the left ear? No. Okay. Tympanic membrane is intact, pearly gray, bony prominences are visible. The bony structures are visible. So everything looks normal on the left ear. Let's come around to the right ear. This is the one that's been giving you trouble. Pain or tenderness? Yeah, she's pulling away. I'll be gentle there. Pain or tenderness on the tragus and the auricle. Okay, I'm sorry about that. Looks like we might need some more antibiotics. Okay, and that tympanic membrane should be pearly gray, but it's actually quite red, erythematous, and has some fullness to it. So you've still got an ear infection that has been ongoing, okay, which is cause for concern. So I'm glad you came in today. So moving on with the neuro exam, again, she is alert and oriented, appears relaxed, has been cooperative throughout the exam. Her thought process is clear, coherent, so we're deferring a detailed cognitive test as part of the neuro because she's making sense for me today. We'll also defer cranial nerve 1, which is the olfactory, because she noted no change in smell, right? Haven't noticed any changes in smell, okay. We'll go ahead and test the cranial nerve 2, which is the optic. So I'm going to have you put your arms way behind you here, And wiggle those fingers until you tell me when you can see them in your peripheral.
Right there.
Right there, okay. So normal visual field by confrontation. She recently went to the eye doctor, usually would use the Snellen chart, but she noted she has perfect 20/20 vision at that recent exam, which is testing cranial nerve 2, and she does not wear glasses. Moving on to cranial nerve 3, which is the ocular motor, cranial nerve 4, the trochlear, and cranial nerve 6, the abducens. We'll check her pupils, eyes, eyelids, cardinal fields. Alright, so red light reflex is present in the left and present in the right. Let you recover there. The eyes are round, equal, reactive to light. Usually her pupils without the light are 3, but they do dilate to about 2 millimeters, which is normal. I'm going to check the conjunctiva. Pink and moist, normal there. Sclera is white bilaterally, so she is pearl. Now we'll check the A, the accommodation. If you could follow my finger into your nose. Great, so she is able to accommodate. So normal vision exam so far. Let's check those 6 cardinal fields, okay? So you'll just follow my finger. We're checking for nystagmus. Okay, I am noting some horizontal nystagmus when I'm holding it out here. So Audrey, you are having some horizontal nystagmus. Sometimes that may or may not impact our vision. You said it hasn't been, so I'm glad it hasn't been, but you are positive for nystagmus, which is giving me more clues at what might be going on. I do see the eyelids are equally lifting, and there's no sign of ptosis there with the eyelids. So that's checking cranial nerves 3, 4, and 6. So we'll move on to cranial nerve 5 with the sharp Dole test, and also check her temporal masseter joint in a moment. So sharp and Dole, just gonna test the senses on your face of the trigeminal nerve. If you could tell me with your eyes closed, is this sharp? Sorry, it might not be the sharpest.
Yes.
Sharp? You say sharp or dull, I'm sorry.
I say sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, so she has appropriate senses of sharp and dull when I'm testing the trigeminal nerve. Now if you could clench your jaw, I'm testing the temporal masseter. So clench, move it side to side and back and forth. Okay, no pops or clicks, so everything is normal. No signs of TMJ or abnormal test there with the temporal masseter jaw bone. So now cranial nerve 7 is facial. If I could have you smile, puff your cheeks, and raise those eyebrows. Okay, so it's all equal. She's not having like droop or trouble with one side of her face that I'm noting. All of those sensations are equal. Just a moment with the light. There we go, light, let there be light. Okay, so we tested cranial nerve 7 for symmetrical facial movement. So now, since she's having trouble with that right ear, recent ear infection, I'm going to do an extensive vestibular test on cranial nerve 8. If I could have you plug your left ear, and I'm going to whisper into the right. And you tell me if you can hear me and repeat these numbers.
Okay.
Are you hearing me say any whispers in the right ear?
Oh no, I'm still waiting for the whispers.
Okay, so might have some hearing loss going on in that right ear, not to scare you, we'll talk more about that. So plug that right ear gently, don't want to cause you any pain, and I'll whisper in the left.
3, 6, 9.
Okay, so you are able to hear me in the left. You might have some conductive hearing loss going on in that right due to that ear infection. Let me do some additional testing, the Weber and the Rene tests. So with the Weber test, I'm going to make this vibrate and set it on top of your head. You tell me if you hear it more in one ear than the other, okay?
Yeah, the right ear.
You're hearing the vibration more in the right ear? Okay, so it should be equal on both sides, but it is going to the affected ear, so again, more red flags that we're having trouble in that right ear. So now with the Rene, I'm going to again strike it, make it vibrate, place it on bony prominence in the back, bony structure behind your ear, and then put it out to the side.
Okay.
And you tell me when you stop hearing the vibration, okay?
Okay. Done.
So you stopped hearing it on the bone? Stop. Okay. So you heard the vibrations equally on the bone as you did in the air, which is also abnormal for that Rene test. Not to alarm you, we'll certainly get you taken care of today, but usually that should be a 2-to-1 ratio, air more than bone, okay? So thanks for cooperating there. So we're done with the vestibular, moving on to 9 and 10. I'm not noting any hoarseness in her voice. It sounds normal, no hoarseness. No difficulty swallowing. If I could have you say ah. Okay, upon examination, the soft palate rises. The uvula stays midline. It doesn't differentiate to the right or the left. And moving on, there is no gag. I'm not going to gag her today, but usually we test that gag reflex. So moving on to cranial nerve 11. I'm going to check your trapezius. Shrug those shoulders. Okay. And the sternocleidomastoid, push against my hand. Okay, so that was equal, that's good. The hypoglossal, I haven't noticed any trouble in her speech. And if I could have you stick out your tongue and move it to the right and left. Usually I would do this with a piece of gauze and testing the strength, but it looks equal to, side to side and no trouble with her speech. So that's good. Or her articulation of words. So I'm going to do a real quick maneuver. It's called the Dix-Hallpike maneuver. We're going to sit you back quickly. Okay, and hold your head this way. Okay, 1, 2, 3. And I would put her head 30 degrees below the table, and she's not having any trouble with this test, not reporting any vertigo or lightheadedness. That was normal, right?
Yep.
So that was a negative Dix-Hallpike maneuver to rule out Meniere's. So no trouble there. Now I'll test your strength. If you could put your arms up, push, pull, and clench my hands. Okay, so strength is equal. If you could now close your eyes and go finger to nose. Okay, so she passes that motor test just fine. Romberg, if I could have you stand up, we'll do a couple things standing. Close your eyes and just stand. Okay, I'm not noticing any increased swaying, so even with that trouble in the right ear, it hasn't gone too far affecting her inner ear. Actually, there is a little bit of sway with that inner ear infection. And now if I could have you put your hands out with those eyes closed. We're looking for pronate or drift. She'll do that for about 20 to 30 seconds. Okay, thank you, Audrey. I'm not noticing any drift. And now we'll check your gait. I'll have you first walk heel to toe, then walk on your toes, then on your heels. Okay, so first heel to toe. Okay, so her gait is still fine, and now on your heels, and now on your toes. Okay, so that's all normal, good. So it looks like we're catching this in just enough time. It hasn't started to impact any of those things. And finally, reflexes. So first I will check the bicep reflex. If you just relax, or I'm sorry, stick that out. Okay. And the tricep, Just relax. Okay. Okay, and the supinator. And patellar, if you could uncross those legs. There we go.
Actually, put that down a bit. Yep, that'll. Yes.
Patellar. And ankle. Usually this would be done differently with the camera and her shoes off. I am going to go ahead and have you take those shoes off and check the Babinski reflex. Okay, that's normal. And also check for clonus, if you could leave that up. Okay, so I'm not noting any clonus upon examination. And a couple other things here. I'm going to place an object in your hand and check for sterganosis. If you could tell me what I'm putting in your hand with your eyes closed. Okay. What does that feel like? A safety pin. Good. And now graphathesia. I'm going to draw a letter in your hand. You tell me what letter. A. Okay, this is normal. And finally, checking proprioception. If I could have that foot again. You tell me if I'm pointing your toe up or down with your eyes closed.
Up. Down, up.
Okay, so all that is normal. Okay, so we've done a thorough neuro exam. I'm ruling out Meniere's because the patient denies tinnitus, no ringing in the ears. The vertigo is not debilitating. It is severe, but not debilitating. Patient also denies nausea or vomiting. And lastly, Dix-Hallpike test is negative. I'm also ruling out central auditory and vestibular system dysfunction or acoustic neuroma because there was no family history of tumor. It does not affect her speech. She denies migraines. Vertigo is not persistent or chronic. It just comes and goes. Also, the patient is not elderly, and this nystagmus was horizontal, not vertical, as is seen with acoustic neuroma. Likely this is viral or bacterial labyrinthitis because it is secondary to bacterial otitis media. Her vertigo is severe. She was positive for nystagmus, which was horizontal, and the patient was recently treated for otitis media and is still having pain and symptoms of ongoing otitis media. So I did notice that conductive hearing loss. We'll get her on some antibiotics and hopefully she'll be better in no time. So thanks so much, Audrey.